hold for another day. But I am pleased, as one who represents a majority district from a minority state, where our state is blessed with a beautiful diversity, that of the additional children, nearly 4 million additional children covered, 67% of those children are minority children. 2/3 of those children are children from families who are working hard, playing by the rules, lifting themselves out of poverty. They are the working poor in America. They are those who have aspired to the middle class or have achieved that status and want to stay there. They simply don't make enough money to afford the private health insurance that this S-CHIP initiative enables them to do. In fact, 72%, my colleagues who might be interested know, that 72% of the children on this S-CHIP program get their health coverage from private health insurance. There are many misrepresentations, and I think they're probably unwilling, because I assume that every person in this Congress cares about ensuring as many children in our country as possible. How could it not be so? It is a deeply held value in our country that our children, as President Kennedy said, are our greatest resource and our best hope for the future. We must invest in them. We have a moral responsibility to do so. When we had the debate on this bill when it first came to the floor, I was delighted in quoting a poem from my youth from Longfellow when he said, "Between the dark and the daylight, when the night is beginning to lower, comes a pause in the day's occupation that is known as the children's hour." This is the children's hour for us in the Congress of the United States. I quoted Longfellow then. I'm reminded of the Bible tonight. And I speak with all of the sincerity and all of the hope that to President Bush, in the hope that he will change his mind, to dig deeply into his heart and think about the children in America who don't have health care. Because if not, I think that the President is giving new meaning to the words, "Suffer, little children." Suffer, little children, if your parents can't afford health insurance. But they're working hard and they're not on Medicaid, but you will suffer because they're struggling to give you the best possible future. Suffer, little children, if your family has played by the rules and they've come to this country and you are here as a legal immigrant, because if you are sick, you will not get health care unless your parents can afford private insurance. Suffer, little children, if you are sick because you haven't had the proper nutrition, the proper prevention, the proper early intervention to your affliction, and you should go directly to the emergency room. But until you can get into that emergency room with enough of a serious illness, you will suffer. That's just not right. I would hope that the President would have had a change of heart and mind since he was governor of Texas. When he was governor of Texas, the S-CHIP program there, and meeting the needs of the children of Texas, ranked 49th in the country. 49th in the country. 48 states were doing better in meeting the health needs of their children, as reflected in the outreach of the S-CHIP program there. Does that mean that Texas is the 49th wealthiest state in the union, that the children in that state can all afford private health care? I don't think so, especially since that state, like mine, as with mine, is blessed with beautiful diversity and people, again, families who've come to America, families who are part of our country, who are struggling to make ends meet, to build a better future for their children. And building that better future is what our country is all about. And those newcomers make America more American. I heard the President say that. We also heard him say that in this term of office that he would enroll every child who is eligible. I'm sure our distinguished majority leader will bring that to the attention of this body. What's interesting about this is that the President, if he persists in vetoing this bill, And by the way, you don't have to be a Latin scholar to know that veto means I forbid. With that pen, the President says, I forbid struggling families in America to have care for their children. Forbid every child to be treated the same if they have an ailment. How did any one of us decide that we were going to choose you will have health care and you will not in a country as great as ours when we're talking about our children? We're talking about our children. So that's why the Conference of Mayors, the U.S. Conference of Mayors, a bipartisan organization, has overwhelmingly supported this legislation. That is why 43 governors sent us a letter in July urging us to come to bipartisan agreement on legislation that would reauthorize S-CHIP to care for many more children in our country. So when I hear the President say that we don't want to help children, we just want to do politics, I don't think he means that. So I hope he doesn't mean that he's going to veto the bill. Senator Grassley said of the President's understanding of our bill is wrong. I urge him to reconsider his veto message based on our bill, not something someone on his staff told him wrongly is in the bill. Actually, he said, in my bill, Senator Grassley said. And Senator Hatch said, we're talking about kids who basically don't have coverage. I think the President has some pretty bad advice on this. And I want to also commend Representative Ray Hood and join you, Mr. Chairman, in saying what a privilege it is to call him colleague and to serve with him in the Congress, and thank him for his leadership in making a distinction between what is about the children and what is about politics in this House. I talked about the mayors, I talked about the governors. 300 organizations in our country, alphabetically from AARP to YMCA, and everything alphabetically in between. Families USA. I heard someone say the doctor should be making the decision. The American Medical Association firmly supports this bill. The president of the AMA stood with us in a press conference today, Dr. Langston, to support this legislation. Society of Pediatrics, everyone who has anything to do or cares about children in our country knows that this bill is the way to go. It's not everything I want. Believe me, it is not the bill I would have written. I would have been far more generous, and it would have been paid for in perhaps a different way. But it would have been paid for, because we are, in terms of bringing benefits to our children, we have absolutely no intention of heaping debt onto them. The Catholic Hospitals Association, again, the list goes on and on about who supports this bill. It's a long list, it's a comprehensive list, and I might include in it that across the country, overwhelmingly, the American people know and respect the value of taking care of America's children, all of America's children. Two-thirds of those polled among Republican voters, 2-to-1, they support passing this legislation and having it signed into law. Why does the President want to isolate himself from caring for America's children? Let's hope and let's pray that a very big, strong, bipartisan vote tonight will send him a message to rethink his position. I see a child in the chamber, our constant inspiration that what we do here is supposed to be about the future. And the future demands that we invest in the health, the education, and the well-being of our children. So, my colleagues, vote as if the children are watching. Please vote as if the children are watching. And please send them a message that this is the Children's Congress. Thank you, Mr. Speaker.